Hi, my name is Bethany Durden. I'm with MMFitness in Marietta, Georgia, and Calhoun, Georgia. I wanted to go over an myofunctional therapy and assessment and why it's important. This is from the Breath Institute, which is a great resource for learning about myofunctional therapy and disorders. It's talking about we assess structure, function, and then address behavior. That is what myofunctional therapy is. The assessment has to do with your structure and the function, and then the behavior piece comes in with the therapy itself. So we look at anatomy, symmetry, airway, sleep, and symptoms. So when we're assessing the structure here, we're looking at the roof of the mouth. Is it growing properly? Is it causing a problem? The symmetry of the face. Is there asymmetry? The tonsils. What is the grade of the tonsils? Are they blocking the airway, causing a problem? We assess the airway um, with in terms of breathing through the nose. Is that a referral that needs to be made to the ENT? Is there a referral that needs to be made to the oral surgeon or dental specialist, or perhaps a body worker to kind of release some fascial knots that you may have going on that are causing the problem? We assess behavior. Is there mouth breathing? Is there tongue thrusting? Is there digit sucking? And why is that happening? Those are symptoms. What's going on? We need to find out what is going on to be able to address that problem. Um, Exercises that we do are tailored to the patient in the area of need. So it's not a cookie cutter method where you can just do these exercises and all is well. I'm going to treat a patient who is 40 years old and having snoring problems or facial pain different than I would treat a 7-year-old who's tongue thrusting. So it's important to assess to determine your patient's need and then address that need. This is a beautiful picture of the tongue. Or myofunctional therapists, we are working with the tongue. The tongue is so important in stabilization. As far as speech, it has to be able to stabilize in the correct places for speech. It has to be able to stabilize correctly for a good swallow. Swallow is the first stage of digestion. It starts the little wave that causes food to go down properly. So it's really important. Um, so that's one thing we do the exercises to coordinate those muscles so that they're able to perform their functions properly. It is all about the tongue. It influences the growth of the airway, the teeth, the palate, the floor of the nose, which is the roof of the mouth, and it can influence the eyes as well. So these are some things that we assess. We do an assessment of myofunctional disorders. Myofunctional disorders are a symptom of a problem, and what we are trying to do, a lot of practitioners, like if you go to the dentist, you get braces, that is a symptom. They fix that symptom, but there was a problem in the first place that caused you to need braces. So that's what a myofunctional therapy assessment does, is try to get to the root of that problem. You have asthma and your mouth breathing. So the asthma is a symptom. We need to get to why all that is taking place. So that's what a myofunctional assessment does. I just wanted to make a little short clip on that so that you would know why the assessment is so important. It is almost, if not as important as the treatment itself. It is as important as the treatment itself because we wouldn't even know where to go without it. So thanks for listening to my video about the assessment. I hope it helps.